Okay, this is my 48 hours after the operation, and I'm having a problem. Just before I left the hospital, they cleaned the wound, well, the cut up. And right at the bottom, they put a new bandage and stuff. And I stood up for a little bit and went to the bathroom. And then all at once I was pouring out blood. So they redressed it up again. And after they redressed it, I stayed there for about an hour before I left. Then I went home, had to stop at Walmart to get pain pills. And before we left there, it was pouring down my leg, the blood again. So I made it to our house here and we cleaned it up and rebandaged it. And I sat there for over an hour without any movement of anything. And then it broke loose again, and now we're cleaning it up again. Now I yell, by the way.
Okay. I'll try to take the most painful ones out first.
Looks like you're about 50 in there.
No, there's not. I think I counted 26.
Yeah, the
was it?
stapler holds 32.
32.
We usually don't quite use the whole stapler.
Oh,
So.
okay.
Usually these ones at the top, for some reason, seem to be the most painful.
Oh,
So, or it's because I start at the bottom. By the time I get up there, you're like ready to be done with it.
yeah, we rubbed her down with alcohol last night and put the antibiotics on it and everything. Last night to get it prepped for you. See, my problem is as soon as I just overdo it one day, then the whole leg swells up big time again.
Yeah, that's what I was telling the patient. You know, you kind of figure out what your threshold is, and because yeah, you can overdo it and be in a lot of pain.
Mm-hmm.
You have to kind of work your way back up into doing things.
Yeah. Feels like the pain's starting right now.
Yeah. As far as therapy goes, since you live that far away, you're probably going to go someplace closer to home.
No,
No, he's
Oh,
going
we're
you're
driving.
next
Oh, you're gonna
part
come
to the
here?
hospital.
Oh, okay. So I will write you, get you.
We already did.
No, we're already doing it.
Yep.
Oh, okay. Very good.
We already started.
Yeah, he did home health care 5 days, I think it
Which
was.
is a waste of time. They drive all the way out to where I live. I want to leave. I don't blame them. Plus, they don't do that much anyway. That one's tender.
Yeah, taking metal clips that are pointing at the end out of your skin, I imagine after a while.
Mm-hmm. Besides the swelling, the only issue I have, which I heard is normal, is
Yeah.
once in a while it pops and cracks when you're walking.
Last one.
So they're kind of like a little staple thing.
Yeah, like butterfly strips, some people call them. You can get it wet in the shower. A couple weeks before you soak it in a tub or go swimming.
Mm-hmm.
You say you can shower or can't?
You can't.
Okay.
You may shower.
Okay,
And these
because
just
I
fall
won't
off.
want-
If these fall off before you get home, that's fine. Just let them fall off on their own.
Mm-hmm.
And again, you don't need to put anything else on it.
Okay.
Just leave it open to air.
Okay, this is day 15. Decided to go in for the therapy treatment. Right at the moment, naturally, my legs swell like a, stuffed goose again. And we're going to give it a try, see how it's going to work out. The range isn't good enough. It's because all of my swelling and stuff that I'm having is causing them not to have the range of motion like I should have. So I'm going to continue to work on it. So that's what day 15 is. Thank you for watching my YouTube channel. I hope this was helpful, and I hope you enjoyed it. When you get a chance, if you would please subscribe to my channel, that would help us out. Thank you.